Attention all women out there. It's the final week of Heart Awareness Month, and it's important to note that it's not just men who are prone to heart disease. Men often have more obvious signs, but new studies suggest women need to take their own precautions. And joining us today is Dr. Robert Wozniak from St. David's North Austin Medical Center to explain. Good morning to you, doctor. Tell us about how heart disease may be different in women.
Well, Brian, it's not unusual for us all to realize that the way women and men think about things are different. So it's no surprise that there'll be differences on how they present with a heart attack. Now, certainly they both present with chest discomfort a lot of times, but women are more likely to present with atypical symptoms that may make it more confusing to the patient, but also the doctors. So it's North Austin Medical Center, St. David's North Austin Medical Center, we're having an event today to raise the awareness that there is a major difference, and we would love everyone to come this morning to this event.
Is there anything that suggests, because of a women's typically smaller frame may lead to smaller blood vessels, and how that could be a factor?
It certainly has an effect on how we treat women when we have to do invasive procedures. We've been doing a lot more of invasive procedures from the wrist so that it would be less invasive and less likely to cause bleeding, which is higher in women. So that is one good example of how we've changed how we do things.
So we have a visual aid here, and explain to us, where the problem areas are in the heart here.
Well, a lot of times when patients have heart problems and heart disease, when they present with a heart attack, it involves the blood vessels that supply the heart. And so on the front part of the heart, we have our different blood vessels that would fill up and block up and cause their symptoms of chest discomfort. But again, in women, a lot of times atypical symptoms such as shoulder pain or even arm pain that they may dismiss as just too much laundry or too much cooking.
Now, are the preventive measures and the treatments the same for men and women?
They both benefit from the wonderful medications that we have and the wonderful procedures, but a lot of times the hardest part is actually getting the woman to recognize that they have to get their symptoms checked out. And sometimes doctors understanding that this is not something related to, say, anxiety or something else, but it's actually they're having heart problems just like men have heart problems.
Age-wise, does it differ between men and women?
Certainly when the presentation of symptoms in a man is about 10 years earlier than a woman, and that sometimes can throw us off as healthcare professionals. So older women about 10 years later versus the men about 55, women about age 65 would be their peak instance for heart attacks.
Interesting that the nurturing instinct sometimes kicks in, and they're more likely to send their husband or father or kid to the hospital and not get checked out themselves. And they need to take care of themselves as well.
Exactly.
Thank you very much for being with us this morning.
Thank you, Brian.
All right.